everyone, I'm Heather Scull. I'm one of the physician assistants here at Academic Alliance in Dermatology, and we're here to show you a demonstration of fractionated CO2 laser. Today our lovely patient will have the perioral rhytids. They're basically the lines around the mouth treated, and she's already been numbed, cleaned appropriately, and prepped, and we're ready to go. All right, ready, Miss Amanda?
Yep.
You wanna put... All right, Miss Marie, here we go. All right. So we're gonna start right here. 1, 2, 3. Good job. How's that feel?
Feels good.
Good. Any pain? Good.
We invite all of our viewers on Instagram to send in any questions, and Heather will answer them while the procedure is taking place.
Are you feeling all right? You feel anything?
Kind of pinch near the nose.
A little pinch? Okay.
Tiny.
So what we're asking her is if she's feeling anything. We pretty much numb this area quite well. This is a very intense laser. This is utilized for many things, from fine lines, deep lines, wrinkles, scarring, or acne scars. It's used for, it's used for texture resurfacing. It's an ablative laser, so it's focusing deeper into the tissue. This is not something to, schedule on your lunchtime break and then go out with your friends over the weekend. This is something that will definitely provide you great results. It's a commitment, but it's so well worth it. I mean, this is one amazing treatment that some people walk away with tears, maybe from a little bit of discomfort, but tears of joy after they see the results. Many people will also have texture irregularities. They'll have pores that they want to shrink. So all of that can be improved with time. And this laser is the one to do it. If you have also something called rhinophyma, which is a rosacea of the nose, more or less, the bulbous looking of that can be treated. But a lot of our women and men want this treatment for more of a global facial rejuvenation. It helps for collagen synthesis or building collagen. It's something that I think all of you out there will just enjoy, and we'll be able to show you her before and after pictures in a couple months. Now, the downtime is a little bit more than some other procedures. It might be about 5 to 10 days where you're noticing the skin becoming more pink again. This is definitely something that you want to have a consult with one of us. It's not something that you can just come in and schedule and do it the same day. You have to make sure that you are a good candidate. It's not for everyone. Certain skin types may not be eligible just because we don't want to destroy their native skin tone. But it's, how are you feeling?
Tiny bit. I can feel it tiny bit, but it doesn't hurt.
Alright, like, do you feel burning? Is it?
That's it.
Okay. What part over here?
Just lightly though.
Okay. Is it still burning or stinging?
No.
No. Okay.
Okay, so we have people sending in questions via our Instagram live. The first question we have is the CO2 laser the best service for wrinkles?
I would say that's a question that depends on the kind of wrinkle. This is something that if you have really, really deep lines, or even if you have just some of those smile lines that are etched in the face and you can't get rid of, or the fillers aren't helping, then CO2 laser would be your best choice. It's something that you may only need one treatment. If you need another treatment, sometimes we wait a good 6 to 12 months later. You want to make sure that the healing process takes some time, but you will see that rejuvenation change over a period of multiple months.
The next question we have is, how many treatments until I see results?
As I just mentioned, I would just do one treatment. I keep close tabs on you and bring you back, but I usually don't recommend another treatment for a good, even 4 to 6 months, even possibly a year. It just depends on what you're looking to achieve. All right? Feel okay? Just so you know what?
Not a lot.
Okay.
And the next question is, what is the downtime for this procedure?
So I always tell patients to give it a good 2 weeks. Plan. The first week's kind of rough. You've got crust and scales or redness. There's a specific post-care plan for skin to treat the skin afterwards. We want you to follow that diligently so that you have good results. But typically, about 5 to 10 days later, depending on the depth of what we do, we'll determine when your skin starts to look a little bit more normal. How you feeling? Okay.
One of our viewers wants to know, what is the difference between this treatment and old therapy?
Old therapy is ultrasound technology. This is a laser. This is a fractionated ablative laser, so this goes deeper into the tissue and vaporizes water. Old therapy helps to stimulate collagen synthesis by ultrasound waves and actually heating up the tissue. So they're totally different. They're utilized in different ways in different parts of the face or body.
The next question we have is, what areas is this laser used for?
So the most popular, I would say, is the face. But we can also do the décolletage, and we can also do the neck, the chest, we can do the hands. But I would say the face is probably one of the most popular. And we're going slow for the purposes of this demonstration, but normally we can go a little bit faster. How's Miss Marie doing?
Good.
She's good? Okay. But as you can tell, this is not pain-free, but we try to make it as comfortable as possible for you. Turn this way for me. The gentle cleansing, staying out of the sun for a good period of time before and after the treatment is important. There are certain topical products that we like to help enhance the healing. You can also use PRP. We can actually use that to be applied to your skin afterwards as well. That speeds up the wound healing. But basically what we're trying to do is create an injury to the tissue to stimulate collagen growth. And with PRP, we can use the fibroblasts from that to help build collagen as well if we were to use that post-treatment. Okay? Sure?
Yeah, that's it.
Good.
So the next question we have sent in is, what is the difference between this and the halo?
The halo laser is a hybridized laser, and what that is basically 2 lasers in one. The halo is not as aggressive, but it can still do similar concerns. It can do similar issues like, fine lines, wrinkles, texture, pores, acne, scars. A lot of times if people are interested in the halo, they may want to do several halos. Not that several halos equals a CO2 because it's a different energy source. But it depends on, of course, their end result desire. Are you feeling okay? Here we go.
Our next question is again about old therapy. Which is more effective, old therapy or this procedure, and what areas can be treated with both?
Well, old therapy, I would have to defer to my colleague, Melinda. So they can be used together to enhance the tissue and tighten the skin, but they also can do similar things. It really depends on the focus area where the patient needs a change or improvement. So all therapy would be something that I would have you, consult with Melinda, my colleague, for more details. You all right? What are you doing out here, though?
Good.
You feeling anything now?
Just a little bit. Just a light burn.
How's that?
A light burn.
Okay. And I have you twist your chin up a little bit. going to do now is do a little bit of a feathering, because this will actually, so you don't create a line of demarcation on the face. All right, ready? There we go. Sorry, feeling that a little bit, huh? Sorry. You're all right. We're almost done with this section. Yeah, all right, here we go. And afterwards, we give the patient some nice cold compresses and cater to them, make them feel good. It's basically what she's going to be feeling tomorrow is more like a really intense sunburn throughout today afterwards. But we obviously numb the skin, and the patient has a little pain, but she's doing great. You're doing a great job. Thank you for being our model today, Marie.
Thank you for
So thank you.